Hi, my name is Mark Kieran. I'm Director of Pediatric Neuro-Oncology at Children's Hospital Boston, and today we're going to talk about some of the basic features of children with brain tumors. When families first find out that their child is diagnosed with a tumor, there are obviously a number of things they want to understand about the symptoms, the ability to resect it, and I often draw a picture of a schematic brain and spine, this being the brain, this being the spine. The eyes would be out here in the front of the head. This would be the hormone section. This is the cerebellum, the part of the brain that controls coordination and balance. The spinal cord comes down here with all of the nerves going off. And it's important to help explain both why the child had the symptom they had, as well as what we can do to actually begin to think about removing the tumor. For example, if you have a tumor in the back of the brain around the part of the brain, the cerebellum that controls coordination, not surprisingly, you can have a lot of problems where the child's coordination falls off, they start tripping, they have trouble doing things like playing Nintendo that they were able to do previously, but also it can affect some of the nerves that come off of the spinal cord. The nerves up here control the movement of the face, so many families will notice that their children's eyes don't quite move in parallel, those kinds of things. By contrast, if you had a tumor out here by where the optic nerves are that run right by the hormone center, children with tumors in this area tend more to have things like they suddenly stop growing normally or they have visual problems. Patients with tumors out in these parts of the brain, the cortex, the more thinking part, tend to have more seizure-related difficulties, whereas patients that have tumors in the spinal cord would have a difficulty if it, for example, was on one side of the spinal cord, might suddenly have trouble moving that arm or that leg. And using that information, even before the MRI scan is done, a good physical exam can almost tell you exactly where the tumor is going to be. The treatment of pediatric brain tumors requires expertise in three major areas. When a child is diagnosed with a brain tumor, and this is a schematic of a brain, and we can put a tumor here, although this would be true in virtually every other part of the brain, the first critical component is the expertise of the neurosurgeons. In fact, neurosurgical expertise is probably the most important factor in terms of the long-term outcome of children. And of course, we're fortunate at Children's Hospital to have 7 pediatric neurosurgeons dedicated to these kinds of treatments. That when a neurosurgeon goes in, of course, their goal is to remove as much of the tumor as possible, but it's possible that a few cells get left behind. That raises the second important modality, which is radiation therapy. And radiation therapy is the ability to use radiation beams that go in and try and kill any of the cells that might have been left behind. The third expertise is chemotherapy, and chemotherapy is just a fancy word for drugs that attack dividing cells. Not just some of the dividing cells that may have been left around the tumor, but drugs that, when injected into the body, can also find the cell that, for example, has broken off of the main tumor and gone to a different part of the brain or the spine, that the chemotherapy running all through the blood will be able to find and kill at the same time that it's retreating this area here. And it's the combination of the expertise of these three fields that really ensure the optimal treatment for every child. The day a child is diagnosed with a brain tumor is probably the worst day in the life of any family. Fortunately, with the expertise, neurosurgery, radiation, and chemotherapy, the majority of all of the children diagnosed here are now long-term survivors. Long-term survivorship isn't just measured by being alive, it's the ability to actually get married, to hold a job, to have children. And we really pride ourselves on the fact that with this dedicated team, the majority of patients now are able to achieve that in a way that they're available not just to their families, but to the community as a whole.